Okay, welcome everyone. Welcome to our fourth conversation in our second COVID-19 inequity conversation series here at the National Collaborating Center for Determinants of Health. This five-part conversation series, and we're in conversation number 4, was intended to examine the relationship between COVID-19 and health equity, and to equip those of you who are participating with us and have participated with an understanding of the key ingredients and approaches to implement and sustain change that prioritizes equity for all. And I know that's what you're here to learn about. So I'm Claire Betker. I'm the Scientific Director at the National Collaborating Center for Determinants of Health, which is one of 6 National Collaborating Centers for Public Health across Canada and funded by the Public Health Agency of Canada. And I want to begin by acknowledging that I'm joining you today from Winnipeg, Manitoba, which is in Treaty 1 territory, the original land of the Anishinaabe, the Cree, the Oji-Cree, the Dakota and Dene peoples, and the homeland of the Métis Nation. The National Collaborating Center for Determinants of Health is hosted by St. Francis Xavier University in Antigonish, Nova Scotia. And there it is located in Mi'kma'ki, the unceded and ancestral territory of the Mi'kmaq people. I welcome everyone today from coast to coast to coast, and I respectfully acknowledge that we all live and work on the traditional lands of the many Indigenous people across Canada. The topic of today's conversation is using and lifting community voices in the pandemic response. So I think if there's a mic open maybe and a little bit of background noise there. So maybe we can ensure that everyone has their mic on mute. In this conversation today, we are really excited to host 3 panelists who are here with us today, and I'll introduce them in a moment, who are working towards health equity in their communities. These speakers have been invited to share how they organized and advocated to advance equity within the pandemic response. And we'll explore how public health in particular can listen to and work alongside communities to ensure that our responses, our interventions, and our work is safe, effective, and equity focused. So just to start with a few housekeeping items, there is French interpretation is available by clicking on the globe. It says interpretation, but it looks like a globe icon at the bottom of your Zoom window. So if you hover your cursor down there and selecting French, if you click it, again, you will also mute the original audio. So all you will hear is our interpreter, Sandra, in French. Our conversation today will be recorded and shared with registrants via email, and it'll also be posted on our website for future reference or for those who are unable to attend today. I'm going to encourage you to use that chat box at the bottom there. All of us are getting quite used to using the chat box for conversation and connection with one another. And what we found in some of the other conversations that we've hosted is that there's almost 2 conversations going on, one amongst yourself in that chat box. And I'd like to ask you or invite you to start right now by introducing yourself, who you are, where you're from, and just starting that conversation. So go ahead and do that now. You can also use that chat box or watch that chat box. Sorry, each of the speakers has sent us some really, I think, interesting and important resources. And our team is with us today, and they will be populating or putting into that chat box those resources as the conversation moves along. And you can also use that chat box for your questions, because while this is a conversation series, we framed the first questions that I'm going to ask our guests today from your input through registration. You're also more than welcome to pose questions in the chat box today. And our team, we have Danielle McDonald with us, Jamie Steve, and Claire O'Gorman. Claire's going to monitor that chat box for questions. And also Pema Mazumdar, I think, is with us as well from our team. So please feel free to ask your questions in French or in English, and someone from our team will translate them so we're able to answer them. And we'll answer as many questions as we can today, but we'll make sure that we collect those questions and get answers to our participants, or perhaps use them to inform our fifth conversation and our final conversation in this series. So this is the second series of COVID conversations that the NCCDH has hosted. The first series included 5 conversations that were held on the 5 Wednesdays in April of 2020. And the focus then was on what needed to be considered in terms of taking an equity approach to planning and responding to the pandemic. And many of us, 1 year later, can reflect back on where we were then and what we were thinking about then, and perhaps thinking about, as Anila said earlier, that this was a sprint. But we've certainly ended up in a long marathon. And those recordings are on our website. They're very interesting. They featured 13 different speakers from a broad range of public health and community organization, and thus perspectives. And we really encouraged our speakers then, as well as in this conversations series, to speak their mind and to be provocative and to push us to think about things in a different way. So we really hope that you'll join us for our next conversation, which is in 2 weeks. It's the final one in this series on April 7th, Wednesday, April 7th. And it's titled The Way Forward from Risk to Resilience, which will focus on next steps in recovery and future pandemic planning. We've hosted this series in collaboration, in partnership with the Office of the Chief Public Health Officer. And in our first conversation, Dr. Teresa Tam sent, I think, a very helpful recorded message that's available online. So participants today are joining us from across Canada, from Dartmouth. I'm going to try to say that with that beautiful accent, Sharon, that you had there. From Vernon, British Columbia, and from Calgary, Alberta. And just to note that about half of you, around 40% of those of you who've joined us today or registered for this conversation, are working in public health and in some capacity, whether it's at a local or community level, at that frontline or coalface, or right there in those communities, or at a regional level, at a provincial, territorial level, or perhaps at a national level. And I'd like to take a minute to thank those of you in public health that have just done some really, really heavy lifting over the last year, and we're very grateful for what you've done to protect our health and to keep us safe. But we also have people from a diversity of other experiences that have also been key players in this pandemic, those from nonprofits, from academic institutions, and also those who play very significant government roles.